Perfect. All right, well, hello everyone. Good afternoon. My name is Jetta, and I am the Volunteer and Outreach Manager at Trellis. Amanda Nickerson asked me to share with you more information on the Trellis programs that make up our organization. So as Title III providers, you normally interact with our programs and advocacy team, like Jolene and Jess and both Sarahs, or the Elder Development Program, Diane and Jean. For some of you who have been aligned with Trellis for a few years, you've had the pleasure of getting to work directly with Amanda. Now, her team, they are incredible servants for older adults, and they love people. And Amanda has shared with me so many times how much she enjoys working alongside each one of you. Today, I have the honor to represent Trellis and give you an overview of all the other programs within the organization that you may or may not have much experience working with. And my goal is to help you figure out how you fit into our work, but also how we might fit into yours. So it is truly my pleasure to be with you today. Now, I know it's in the 2 o'clock hour and it is after lunch and you've had yummy food and you might need a nap. So quite frankly, it is the most undesirable time for a trainer to present. But folks, I don't believe in boring classes and I am all about the fun. So what I want you to do is take a deep breath. I want you to stretch those hands up in the air, go right and go left. Don't worry. There you go. I'm watching you. Jess Norman, I don't see you. Amanda Biggis, there. Abby, I'm seeing you. There you go. Take a deep breath, right? And exhale. Give ourselves a great intention, whether you're standing at your chair, whether you're sitting. My hope is to stir up in you questions and possibilities for future engagement. So if you're willing to be a little playful, we're going to have some fun today. And if you want to pull that pet up on your lap or a small child, more power to you. They love fun too. So I have three tips for you this afternoon. My first is before we get going, to have a notepad next to you. Jot down any questions you have as I review our programs. Following this session, we're going to navigate into breakout groups, the document that Amanda Nickerson had sent to you yesterday and then us this morning. You're going to have special time with our staff, right? You can ask any question that you want. You're going to discuss ways maybe to come closer to Trellis. Think about ways that we can improve together how we serve our beloved elders. My second suggestion is to let you know at the end of today's presentation that I'm going to direct you to a website to add your thoughts. We're going to go to menti.com, menti.com. So if you want to get that on the next computer screen on your URL, we're going to use that a little bit later. And finally, if you want to silence your phones, close your emails, turn off or mute Teams, just let yourself enjoy the next 30 minutes or so. You will be glad that you did. So let's get started. Ahalan, wasahalan, which is a greeting from my beloved grandmother. It doesn't matter who you are, what language you speak, where you come from, what organization you're affiliated with, who is on your team. Those of us at Trellis want you to know that we're glad that you're here. We're glad that you're part of us and that we, in other words, want to say welcome. I'm glad that we're sharing space this afternoon. And whether you have been a trusted partner for 10 years or 10 minutes, I hope this session will give you more information on our staff, our programs, and the passion that we feel when we serve our beloved elders. What we know is that we are stronger together. So the more knowledge you have about resources and services across Minnesota, the better you are to assist your staff or the older Minnesotans with whom you affiliate or the care providers that work with them. So here at Trellis, our mission is to assist individuals to age successfully and to develop the capacity of communities to care for an aging population. What a responsibility that is, my friends. What a blessing. We support this mission by providing services, information, and innovations to help people optimize their well-being as they age. That's the vision for our work. Our aim is to be thought leaders in our field and to be change makers. And as life changes for our population or the landscape of the world shifts, we want to be at the forefront, leading the way, paving the road and smoothing it out for our older adults throughout the community. And we're really glad that you are with us along the road. Now, to understand where we're going, it's helpful to know where we've been. So in a nutshell, in 1965, the Federal Older Americans Act passed, and Title III dollars that fund your programs come from this act. In 1973, the Metropolitan Area Agency on Aging, our original name and a whopping 14 syllables, was established as a program of the Met Council to respond to the Federal Older Americans Act. The purpose was to provide community social services for older persons, specifically to address nutrition and the social needs of older adults. In 1994, the Minnesota Board on Aging developed the Senior Linkage Line to provide older adults and caregivers with better access to resources and services. Trellis, in fact, became an independent nonprofit this year and was designated as the Area Agency on Aging for the 7-county metro area. And in that role, we began providing Senior Linkage Line services. In 2000, the Federal National Family Caregiver Support Program made it possible for Trellis to expand support to caregivers, adding services such as support groups, respite care, and family consultations. And during the second decade of the 2000s, we worked to build inclusive networks and connections to support an integrated approach to aging. And this focus can be seen in ACT on Alzheimer's as well as Juniper, which we'll talk about next. And today, in 2022, we're here together. Trellis has grown in size from a handful of employees in the early years to, as Down said, to over 100 full-time employees, and we support more than 80 volunteers. And we have had a strong record of hiring during the global pandemic. We are hiring right now for a number of jobs, and I think we'll throw in the chat the link to our hiring website, but we welcome all creative and compassionate souls who want to support older adults. Now, my goal today is to share with you all of these programs where we support our beloved elders and to give you kind of a little peek behind the scenes of our organization. The more you know about us, the staff, the better you are advocating for older Minnesotans. So right now, we're going to go to a poll. I'm going to ask one of my colleagues to help link that poll up. Perfect. All right, so the question is, beyond the grant monies that you have for American Elders Act, what program within Trellis is the most familiar to you? There you go. ACT on Alzheimer's, dementia, maybe it's Juniper, Minnesota Help, pre-admission screening, pensions. Scroll down, there should be 8 on the screen. Perfect, there's over 100 of us in the group today. We've got about half of us pulling in there. You guys are very good at this poll thing. Well done in the Zoom world of the pandemic. Perfect. I am seeing lots of activity. We're up to about 60, giving folks a couple more minutes to pop in. All right, I'm going to end the poll right now. We're going to show some results. Perfect. So on average, we've got most people are most familiar, at least half, with the Senior Linkage Line, which makes a lot of sense. But other people know ACT on Alzheimer's and Juniper, Minnesota Help. Okay, so let's get going. I thought that would be interesting for us to get a little sense of behind the scenes, and I'm going to start working on a tour of these programs. So first up, I'm going to highlight the dementia-friendly communities. Trellis supports 3 statewide initiatives that are working to make our communities good places for people with memory loss to live and to thrive. And we work to create dementia-friendly communities. And as we do this work, we are bringing together neighbors to learn, to share, to advocate for a welcoming community for all people living with memory loss and those that care for them. So the programs you see on your screen are programs of Trellis. The first step is ACT on Alzheimer's, right? It's a statewide collaborative that equips communities to support people with Alzheimer's disease and other dementias. We have the Dementia Friends. It's a simple approach to change the way we talk, think, and act about dementia. And the Remember Project, which is where we use the arts to end the stigma of memory loss through one-act plays performed by professional actors. Last fall, our staff hosted a statewide summit on dementia-friendly communities and highlighted activities happening around the state in different communities. Look for that to happen again next fall. Stay tuned. Now, do you see that symbol on the screen right here? When you see this, this is your cue that I'm going to give you a tip for engaging with Trellis to better serve older adults. For instance, as a provider, you might serve beloved seniors experiencing memory loss. It is a hard road. We know many of us on staff are caring for parents or grandparents walking this road. 8 of our Trellis staff and volunteers are trained to offer the Dementia Friends information sessions. We can do this in person, we can do this virtually, and you can request a simple presentation absolutely free. Now, maybe you serve seniors whose native language isn't English. No worries. Trellis has offered this presentation in Spanish and in Hmong, and we can work with you to train your staff to become Dementia Friends champions so that you can offer it in your home language because it feels better to our seniors when they can hear that information from their own native tongue. Okay. Now we're going to move on to the second area that I want to highlight, which is Juniper. It is a network of community-based organizations and health systems that offer evidence-based health promotion programs to people throughout Minnesota. Together, we are helping people live healthier, more fulfilling and connected lives. And since 2018, we have served over 12,000 people in this program. And there are 13 staff that work on the Juniper program. Organizations that are part of Juniper include community centers, social service agencies, senior housing health systems, block nurse programs. And I know many of you today offer Juniper classes in your community. So if you do, why don't you give me a thumbs up or a heart emoji so we can see who across the network might be offering those types of programs. Right. If you want to in the chat, feel free to list that you offer the diabetes class or you offer the chronic health class. Right. Okay, I see a couple hearts. I like that. Fantastic. All right. Now, in terms of Juniper, we offer 13 classes in 3 categories: live well, get fit, and prevent falls. Now, these are fairly self-explanatory, listed on the screen, but I do want to highlight a new initiative in 2022. Last month, we rolled out a new initiative called No Falls Minnesota. It's a campaign in collaboration with the Department of Health, Minnesota Board on Aging, the Minnesota State Fire Marshal, 16 regional healthcare providers, as well as 70 community-based providers. Many of them might be here in this room. Now, all of us together are working to implement this awareness campaign to keep older adults active, strong, and on their feet, right? And why do we feel so strongly about this? Well, strength and balance are key factors in preventing falls. And every 11 seconds, 1001, 1002, every 11 seconds, an older adult is treated in an emergency room for fall. And 1 in 4 adults over 65 fall each year. And sadly, Minnesota ranks 4th in the nation for deaths due to falling. But falls are not inevitable. We as professionals knows that. We know that it's not a normal part of aging. So how do you learn more? Again, right here with your stars. You might want to connect with Juniper in terms of knowing their website, hosting a site, or learning more about how to become a provider. Now, again, after my session, we're going to be offering breakout rooms for each of the programs that I'm discussing this afternoon. So if this is one that you're interested in, feel free to drop in and ask all the questions that you're interested in. Now, moving on, I'm going to move to a truly hidden gem within Trellis. Trellis's pension and retirement rights helps workers, retirees, and their families find lost pensions and retirement plans offered by private and government employers. What's a lost pension, you ask? Well, I'll tell you. Let's say that you worked for a company for over 20 years, right? You weren't ready to retire, so you stepped away for a few years. Now you're ready to fully retire, and now the company is out of business. They dissolved, right? Panic sets in. You have saved an entire lifetime and it's gone. Or maybe your partner or your spouse passes away and the company is telling you that you don't qualify for spousal benefits. Can you imagine the level of anxiety you might be feeling? Well, I'm happy to tell you that pensions don't magically disappear. By law, they need to be transferred from one entity to the next. And so our staff and our volunteers put on their investigative hats and they start putting together the missing pieces of that puzzle to help the folks that reach out to us. Just to put some things into perspective, in the last 10 years, we have served more than 2,000 clients and we've recovered $9 million. Let's say that together. $9 million. That's amazing in terms of how we were able to serve. And we do this work with 2 staff, 3 volunteers, in addition to legal aid staff in a variety of states. So the neat thing is that we get to provide free assistance to folks who have legal questions about their pensions. We offer these in states other than Minnesota. It's also Iowa, Nebraska, Wisconsin, and both Dakotas. And the thing that really warms my heart is that this team is serving primarily low-income seniors, right? They have an average age of 68 and an annual income of less than $50,000. If you're interested in engaging with our pensions team, feel free to direct folks right to that website to learn more or to make a referral directly from the website, okay? So Let's turn our attention to the senior linkage line. Of all the programs, as we took the poll earlier, this is the one where most of you are most familiar with Trellis and the senior linkage line. And so for those of you who would like to, give me a thumbs up or a heart. Maybe you have used the senior linkage line. How many people have called the toll-free number? I'm looking over to my screen. Okay, Adele's like, yeah, I'm with you, sister. Okay, good. It's important if you want to write in the chat in terms of where you're accessing, feel free to do that. We'd love to see a little bit more. But the Senior Linkage Line is a statewide service of this Minnesota Board on Aging in partnership with Trellis and the other 5 area agencies on aging within the state. At Trellis, 22 individuals take calls on the phone line for us. Now there are 6 area agencies on aging throughout the state, and no matter where you are in the state of Minnesota, no matter which of the 87 counties you live in, the Senior Linkage Line can help. And calls are directed to a specific office based on the area code. So here in the Twin Cities, if we're from 651 or 763, for instance, they're going to be directed to us. But during really busy call times, think Medicare open enrollment or the day following any holiday, you may not even know that you're going to be transferred to another regional call center due to high volumes. For me and my family, my brother and I were working last fall to find housing options for my grandparents. They needed to move. So my brother called and made some connections, and he reported back to me, and he said, I really, really loved working with Kathleen. And so I'm on the phone with him, and my eyes are up thinking, Kathleen, Kathleen, Kathleen. I don't know Kathleen. And I later realized she was from the St. Cloud area, right? She made us look great. And so our team here in the Twin Cities tries to do the same, whether folks are calling from the Duluth area or Rochester. We want to make sure that no matter where you call from, that you're getting the greatest service possible. Now, the folks who take calls on the Senior Linkage Line, they are incredibly well-trained folks that help consumers with a lot of options, whether it's senior housing or chore or homemaker services, nursing services, medication setups, transportation, home delivered meals, adult daycare. These should be very familiar for a lot of our Title III providers, right? Because we are referring them through our services back to you often. It is truly a one-stop shopping model that we use. And if we can't answer any of the questions that come in, we're going to find someone who can. Tenemos traducciones, right? Do you need translation? Do folks in your agencies not speak English? We offer translation services for consumers who speak up to 140 languages. So the most important thing is to work with the folks in your agency, the seniors that you serve, that they might say Espanol, they might say Hmong, they might say Oromo, and just pause, and we will take the time to connect them to the language line. The most important thing to know is that we are free, right? Meaning any of the referrals that we give out are at no cost, because we can do this because we're funded by state and federal dollars. We are neutral, meaning that we're not going to recommend one provider over another company. We just want to give folks options so that they can choose the best that works for their family. And we are objective, right? We're going to share all the information and help folks make an informed decision, particularly during a Medicare call, for instance. We are not insurance agents. We are not insurance brokers. We have no financial stake in the choices that are made. So we're simply here to give great resources and let the families make the best choice. Okay, so we're going to go for the fun time today, my folks. I want you to get your hands ready. We're about ready to drop some things in the chat. Note to staff on the line, you are not allowed to play our game today, so hands down. But I'm going to give you a bonus point for the first person to type in the chat the answer to the question. So get yourself ready. At the end of the prize, it will be a prize from the Senior Linkage Line. And I just want you to let you know that there will be chocolate involved. So ready? All right. What is the toll-free number for the Seniors Linkage Line, my friends? Dun, dun, dun. Oh, John Burkow wins. Fantastic. It's right. Well done. Perfect. Winner, winner, chicken dinner. John wins. We're going to make sure we get your address, John. I'm going to send you a lovely care package from the Senior Linkage Line. But 1-800-333-2433. I know, Amanda, that was so fast. He was impressive. All right, let's turn our attention to Minnesota Help. Have you ever wondered how Trellis and the other organizations power the Senior Linkage Line from behind the scenes? Or how staff are able to answer thousands of questions we do? It's the data management project, right? It's our superpower, folks. If you want to give me a thumbs up or a little heart on your photo if you've ever used Minnesota Help. Oops, let me pull back. if you look here on the left-hand side, we don't just help just seniors, right? It could be disabilities or homeless or veterans. A lot of different things go into the behind the scenes, right? And the database that we use lists nearly 11,000 agencies with more than 60,000 points of service. And this is a team powered by 10 folks. For instance, this is a team that last year had a huge lift, right? They had the task of keeping up with the assisted living licensing listings. Assisted living licensing listings. Say that 3 times fast, my friends. They moved over 2,500 housing with services listings, and they added almost 2,000 new assisted living licensings. It was a major list. They did incredible work for the behind the scenes. And these are folks that don't like to be in the forefront. They like to be behind the scenes. Now, if you navigate to the top, it says select language. I'm going to point out 2 pieces of this website. One is the select language, and the other is provider portal. If folks click on the select language, with a click of a mouse, you can turn this language into any language. Presto, this is Hindi. This is Somali. You get the idea. So all you have to do is to tap into these resources and help navigate. So if it's easier to read it in English or Hindi, you get to choose whichever one is more familiar to you. Now, as a provider, again, in terms of engaging with us, you might want to do a couple things. One is become more familiar with this really powerful tool. You can help seniors use this technology more fluidly. You can actually do the zip sorts. To look at the granular level of the Twin Cities, find respite care, providers, or housing, right? That's one option. Number 2, if you decide, I don't want to do that, I want to send it right to the senior linkage line, give us a call. And John knows that number really, really fast. We can do all the heavy lifting for you, right? It's what we do. It's what we do best, right? And third, what I would love for you to do is take a look at the information that we have listed on you and your agency. You might want to edit it. It may be a couple years since you've looked at it. And I want you to look here, again, right here on this provider portal. All you have to do is click that button, and then this one comes up. You can either chat with us, or you can send us an email and just review the information that we have behind the scenes, okay? So let's do one more thing. The final thing that I want to mention with regard to the data management project is a website that they update called Help Me Connect, right? Typically, this would be really helpful for your organizations if, let's say, the grandchildren live in the same house as the grandparents. We've got an intergenerational population being served. That may not be all of you, but it may be some of you. Our data management team manages this website called Help Me Connect. It's an interagency collaboration between the Department of Education, Health, and Human Services. And they provide access to services to help pregnant women, as well as parenting families with young children connect to services so that their health and safety. Now, you feel free to research that program, but that's the piece that I wanted to talk about on the data management program. We're going to move on to another really cool part of the senior linkage line. It is called pre-admission screening, and our pre-admission screening team is comprised of 15 staff members. Prior to admission to a skilled nursing facility, an individual needs to complete this pre-admission screening. In fact, it is required by statute, right? The reason for the screening is to make sure individuals meet the level of care needs for a nursing facility, so that maybe someone is, we try to prevent them being placed inappropriately. You know, they have a care level at this level, and we don't want to put them in a care facility that is not able to meet their needs. So it helps us to identify people whose needs might actually be better met in the community rather than in a care facility setting. And the pre-admission screening is also intended to screen folks and refer individuals who may need benefits from additional supports or services. So it's important to know that the pre-admission screen is a relationship that an individual has with the team, and it's a short-term relationship. Okay, so it's kind of harder to understand this piece, so it's real important to kind of know behind the scenes. I'll tell just one impact story, right? One of our recent situations involved one of our staff members. They had to file a vulnerable adult report based on information that she had recovered or what's the word, discovered in a pre-admission screening. And during the PASS process, the county staff person advised us that the individual they were working with didn't actually make it to the nursing facility. They didn't show up, right? So to give you more detail, this person had high medical needs. They were unable to walk. They were dependent for all activities of daily living. They had a history of chemical dependency. And the hardest part is that right before they were about to be hospitalized, their home burned down. So our specialist on the line called out to the hospital social worker, figured out who the person's waiver case manager was, connected this person, and filed the vulnerable adult report. And through all this work, staff learned that the person who didn't show up to the nursing facility was actually living in an extended stay hotel that was paid for by a friend. So because of this work, now their caseworker is actually involved working with them to try to find a longer term plan than just staying in an extended day hotel. And without Trellis's intervention, the individual would have likely fallen through the cracks. So stories like this don't happen every day, but they do happen. And we're really proud to be part of serving older adults in ways that truly impact their lives. So if you're interested in getting involved from an engagement status, your agency could request literature or magnets to distribute to the clients about the pre-admission screening program. I'm going to switch now to return to community. Consider this scenario. You've got an older adult you're working with who had a fall or a stroke. They end up being rushed to the hospital. Then after some time, they step back to a care facility for rehab. Your team can refer folks to the return to community when an individual wants to transition back to their home while they're in that skilled nursing facility following a type of incident like a fall or a stroke. But they may need some help to live independently, whether it's at home or in a residential community. It's important to know with Return to Community that it's free, completely free service. And this is a program that actually started with the public agencies and nursing facilities, but over time that partnership has grown to enlist the help of all health and home care providers. And our 15 community living specialists within the senior linkage line provide one-on-one assistance. So for folks who qualify, they can receive assistance locating resources. For instance, maybe you have someone who wants to live at home and all they need is a handrail in the bathroom or a shower chair, right? We can provide referral to durable medical equipment. Maybe they are in a temporary wheelchair and they need someone to help mow their lawn or do other yard work. We can help. Maybe they need to get to a doctor's appointment, but they're still healing from a broken hip, right? We can line up transportation options for the family. So as opposed to the pre-admission screening team, the return to community team is a long-term relationship. We can actually work for up to 5 years, and we'll continue to check in on this individual to make sure that they're receiving the resources that they need to remain safe and independent. And last year, this team, many of whom are social workers, and I want to give a call out for Social Worker Month, this team managed over 4,500 client referrals from a variety of sources: hospitals, nursing facilities, home health care, and many maybe from your provider agencies. In terms of connecting with Return to Community, as a provider, you can serve your population best by being aware of these services and where the Return to Community program might be able to step in. And if you have any questions, like I said before, join us for that breakout session. You have the opportunity over a 30-minute period to attend 1 session, 2 sessions, 3 sessions. Join them as you want. And as with all of our programs, if you want literature to share with your staff or older adults that you serve, need only ask. All right, friends, I am going to end with the presentation talking about my team, the volunteer and outreach team. I lovingly refer to us as the fun team. We are the smallest team on the senior linkage line with only 8 staff. If there has been anything that you've heard today and you're thinking to yourself, my staff needs to know more about this, the seniors I work with could really benefit for a presentation on Medicare 101. You have folks who you're working with that are coming up on that magic age of 65. We have a presentation we can give. Maybe you want to share the senior linkage line presentation with other staff that you work with. We can do that. Maybe the information I shared about minnesotahelp.info was of interest and you want to share that with your staff or others. We can do a presentation. Or if it's related to healthcare directives or fraud and scams or things related to staying strong and the fall preventions campaign. All of these presentations can be done and in person. They can be done virtually as well. Now, my team, as I said, is volunteer and outreach. So I'm going to tell you just a little bit that on the community outreach side of our team, my team speaks 6 languages: Spanish, Hmong, Somali, Oromo, Amharic, and English, right? And we have recruited a few volunteers who speak a few more. As a result, in 2021, for the first time, we started giving presentations in languages other than English. And we have been creatively working with some of our partners. For instance, recently we worked with the Korean Service Center to translate one of our presentations in real time. We didn't have that staff person that spoke Korean, but we partnered with the center to do so. And I know we've done that with a couple of other of our close partners. Our team conducted 24 media interviews last year, forming new relationships with KFAI and the Jefe, Univision, Cali TV, Hmong radio broadcast, as well as WCCO. And our volunteers give us a really big lift on this part of the team. giving presentations, showing up to community events, to work at exhibit tables, for instance. Now, on the volunteer side of the family, 2 years ago at the beginning of COVID, we had 69 volunteers. And today, I'm really proud to say we have 81. My goal is to grow the program past 100. And we are currently recruiting volunteer ambassadors in a variety of community organizations. If you would like to come closer to Trellis, this might be a great opportunity to keep current with all things related to the senior linkage line, as well as Juniper or Act on Alzheimer's. In terms of volunteer ambassador, think of it as a wagon wheel. At the center of the wagon wheel is Trellis, information and knowledge to share. And then each of the pings of the wagon wheel, each of the posts, each of the threads go out to different organizations. And we are placing volunteers at each one of those community organizations to be a conduit of information back and forth to Trellis. Not only are we getting better information about what the needs are in the community, but it helps us provide information. So you might have a beloved senior that you think is just that right person. We're looking for that person who's just the butterfly socially, who loves to interact with individuals and gather information. It might be a staff person, and we're placing them at senior residents. We're placing them at Kiwanis groups. We're placing them at women's voting group. We're placing them at our partners at Bryant Coyle. Just put 3 individuals in place over there. So if you want to learn more, please join our breakout session coming up next. And one area I want to talk about next is our current volunteers. Right. On this slide, you'll see a few of our current volunteers, regardless of their role. Medicare counselors, when they're making presentations to the public, they're working in pensions or volunteers. They love donating time to the mission, and we love supporting them. And our volunteers do their work in a variety of ways. Sometimes it's in person, sometimes it's on the phone, sometimes it's completely virtual, depending on their comfort level in a pandemic world. And we've had a lot of significant flexibility to play to their strengths, but also to accommodate their fears. During the last 13 months, we onboarded 28 new volunteers, and 50% of them spoke more than one language. So as I end the presentation today, I want to thank you for your time. I'm going to ask you to navigate to menti.com. The code is 7337 2107. If you have not worked with Menti, it is the smartest technique out there. All you have to do is go to menti.com and put in this code. We just put it in the chat. Let's put that code in the chat, please. And then I'm going to stop sharing, and I'm going to, there we go. I'm going to pull this one down. There we go. And so I'm going to ask you to just list one action step you'll take as a result of today's information. What did you learn? What have you, review. There you go. What do you want to take on just as some personal responsibility for today and the actions, right? Feel free to drop things in chat as you learn more. Schedule a presentation. Oh, I'd love to hear that. Perfect. Peruse. I love that word, peruse. Well done. Perfect. Gain more information, explore, review, connect with presentations, connect with program staff, learn more. Right. I think it's important for each one of us to kind of take responsibility for things. We are here definitely to help you gain. Again, as I said at the beginning, we are stronger together, and we want to make sure that we can give you more information, to give you more strength and allow you to be the best, because when your seniors in your organization thrive, we've met our mission, right? To assist and to develop. So I appreciate your time today. Thank you so much for listening. You've been a really great, I know you're all muted, so thank you so much. I'm going to stop sharing right now. I'm actually, before I begin, I'm going to take a picture of that screen because I think it's really beautiful where we're at. And then I'm going to turn it right back to John. There we go, photo, and everyone smile. Jeez. All right, I'm going to stop sharing. John, back to you.
Thank you, Jetta. And this is also another good time to go for that 7th inning stretch break. So if you want to take that stretch, stand up, take a breath. We are going to move towards the more interactive part of our session together. For the next 30 minutes, we've carved out time for each of you to connect with each other as well as with Trellis staff. We have 6 designated Zoom breakout rooms. I'll ask staff to go to their designated breakout rooms if they haven't gone already. The 6 breakout rooms are that are covered reflect the service areas that Jetta had shared. The first one is our minnesotahelp.info. The second is the senior linkage line services that include our pre-admission screening, return to community, and our contact center, which is the senior linkage line itself, the phone service. The third is our volunteer and community outreach team. The fourth is pension and retirement rights. The fifth is dementia-friendly communities and Act on Alzheimer's. And the sixth is Juniper. So here's the guidance, is that we've got 30 minutes. So I would recommend that you could go to 3 within those 30 minutes. The staff kind of are doing a reset every 10 minutes. So that's what we would encourage you to do. If you would like to hit all 6, we are fine with that. So if you want to spend 5 minutes in each room and kind of get a sense of what's happening in each of those areas, please feel free to do that. But we would recommend choosing 3 rooms for 30 minutes and for 10 minutes. With that, the links for those breakout rooms are in your agenda. So go ahead and self-select into whichever breakout room you would like. And we'll give you the next few minutes to transition over there. And if you have any questions, feel free to type into the chat here. We will have a staff person who continues to be in this Zoom room if you're having troubles finding the links or finding your breakout room. With that, this is the last time we'll be all together. So thank you, everybody. Really appreciate you being a part of our Trellis provider network and attending this session. Enjoy your breakout sessions. Goodbye.
Just a note that we will be keeping this meeting room open, but there is no activity here, just a redirect if you need help getting to a breakout room. So we're not going to do the leave meeting and then it, shuts everything down. Also happy to just chat if you're curious.
Can we have the link on the chat?
Yeah. So there is a document that was downloaded into the chat. Jess Nordman put it in.